Working the upper abs. Yeah, now going to work the lower abs. Hey, how often do you hear that? Hey, this exercise works the upper abs, now we have to do the lower abs. So we're going to do another exercise which is normally involving lifting the pelvis to work the lower abs. Now if you had such a thing as upper abs and lower abs from an anatomical point of view, tell me what is the origin and insertion of the upper ab and what is the origin and the insertion of the lower ab? Because every muscle has an origin and insertions of two attachment sites that attaches to the skeleton. So if you look at the origin and insertion of the rectus abdominis, which we're referring to, its role is to flex the trunk. Its origin is the anterior pelvis or the crest of the pubis, and the insertion is the sternum as well as the ribs. And it flexes the trunk by bringing the sternum and the ribs towards the pelvis, or bringing the pelvis towards the sternum and the ribs. So all it does is it's the same action called flexion, but you're just bringing one point to the other, or vice versa, the other point to the other. So is there an upper and lower ab? Of course not, because I guess it's like a piece of rope. This is a piece of string here, and if I pull on the rope, it develops tension through the entire rope. That's like saying if I pull on this side, it's working this side of the rope and not this end of the rope. But if I pull on this side, it's working this end of the rope and not this end of the rope. Whichever end I pull, the tension is distributed through the entire length of the rope. Whichever side I lift, the tension is developed through the entire length of the rectus abdominis. Now sometimes you may feel it in different parts, and sometimes emotionally you feel it there because you want to feel it there, and sometimes you feel it there because there might be other acting muscles involved in that particular hip lift or lifting the torso off the ground. But when it comes to training the upper abs or lower abs, you can't separate them. They're all connected. Yes, you have separations of fascia or the through, but there's no bone to stop the tension in between the origin and the insertion. So there's only one rectus abdominis, and yes, you can train it with different angles and different positions and moving the pelvis or moving the ribs, whatever, but it's still only one muscle. I can pull on this way, I can pull on that way, I can pull that way, I can pull that way, but the tension is going to go through the entire rope, as the tension will go through the entire rectus abdominis, and you're going to be working the rectus abdominis in any of these exercises. And probably the best way to work the rectus abdominis is not laying on the floor anyway, because that's not how they function. They function to stabilize yourself in the upright position. So why are you laying down to train muscles that function in the upright position? So better off going and do some squats and deadlifts and lunges. At least you're going to train them functionally the way they act in your life, and that would be no kapu.